Do you ever feel like your brain runs out of energy and it just doesn't have the endurance that you once had? You're not alone. If you struggle with cognitive fatigue and low brain endurance, it can really make you unproductive and unhappy with your performance in work and in life. Now in this video, you learn the truth about cognitive fatigue, how to recognize symptoms, what the root cause is, and you will learn 7 practical strategies to beat it. So watch this video all the way to the end to get all the clinical nuggets. Now, I'm Dr. Peter Kahn, board-certified chiropractic neurologist and functional medicine doctor. Now, cognitive fatigue describes symptoms of decreased brain function with low brain endurance. Now, cognitive fatigue is different from physical fatigue. Being physically fatigued means that you're tired all the time, even after you had proper rest and proper sleep. You just don't seem to recover normally. Now, with cognitive fatigue, the symptoms tend to be brought on when you use your brain. It just tires out prematurely or quicker than before. Now, you may have cognitive fatigue if you have some of the following symptoms. You may have difficulty staying focused and concentrating for extended periods of time. You may have decreased attention span and feel like you have ADD. You may have difficulty learning and retaining new information. You may be feeling that you're more forgetful now and you have difficulty recalling information, things that happened recently, or even forgetting words. You may have decreased ability to solve complex problems or think critically and to make quick decisions. You may notice yourself making more frequent mistakes than before. You may be experiencing fatigue when you're reading sooner than in the past. Or you may be experiencing fatigue when driving sooner than in the past. Or you always need caffeine or some other stimulants just to function and stay alert. And lastly, you're noticing more and more overall decreased brain function that is causing problems in your life. If you have cognitive fatigue, it can be really frustrating because you feel like you can't perform and excel at the things that you used to do, and you're now falling behind. You know you can do it, but you just don't have the brain endurance to keep it up. Perhaps you used to be able to read for hours and retain information, but now you read for 5 minutes and you feel sleepy and tired, and you just can't remember what you just read. Perhaps you used to be able to watch a TV program and remember and enjoy the content, but now you fall asleep watching TV after 10 minutes on the couch. Perhaps you used to be able to fill out some paperwork or do your taxes, but now you can't stay focused or organized enough to complete them. Perhaps you used to be able to go on a road trip in a car, but now you fall asleep at the wheel easily or sooner than before. You see, these can all be indicators that your brain's endurance and function is declining, and it's vitally important for you to find out why. So how do doctors diagnose cognitive fatigue? Now, there's no gold standard agreed upon test for cognitive fatigue. The diagnosis, if one is even rendered, is solely based on symptoms, history, and questionnaires. But even if you get diagnosed with cognitive fatigue, the diagnosis tells you nothing about what's causing it. And therefore, no real treatment to address the root cause is offered other than symptom-masking treatments with some drugs. Now, unfortunately, most conventional primary care providers do not understand the mechanism or root cause of cognitive fatigue, and many doctors don't recognize the symptoms and simply attribute it to something else, such as depression or stress, and then prescribe a medication to mask those symptoms. Now, patients are often told that they're just getting old, and cognitive decline is to be expected. Now, while we all age and become physically or mentally slower compared to our younger selves, if your cognitive fatigue symptoms are progressively worse and accelerating, this will be cause for concern that something more serious is going on. This should serve as a call to action for you to start looking into the root causes of your cognitive fatigue and make the necessary lifestyle changes to slow down the progression and improve your quality of life. Now, in my practice, I use a clinically proven neurometabolic roadmap to help you identify the root causes and determine a course of action based on a sequence and priority of the most pressing needs of your unique condition. Now, the first step to overcoming any physical symptoms is to identify the root cause. So here are possible root causes of cognitive fatigue and decreased brain endurance. Now, the first root cause of cognitive fatigue or low brain endurance is brain circulation problems. Now, your brain is a very energy-intensive organ. It weighs only 3% of the body weight, but uses up about 30% of the body's energy. So it's very energy intensive and requires a lot of fuel, and that fuel to the brain is delivered via blood circulation. So if you have poor circulation to the brain, your brain's not going to get the fuel it needs. It's going to have reduced endurance and cognitive fatigue. Now, how can we know that you have brain circulation problem? Well, we can use symptoms in your extremity as an indirect way to tell. Why? Because if you have poor blood flow to your hands and your feet, then you may have poor blood flow to your brain. Now, so ask yourself if you have symptoms of cold hands, cold feet, perhaps you're cold all the time, even in the summertime when everybody's nice and warm, but you just can't warm up. You may have cold nose because nose is part of the head. So if you can't get blood to the extremity or the tip of your nose, you may have poor blood flow to your brain as well. Now, another way to tell whether you have poor circulation is look at your fingernails. Are they healthy? If you have poor nail growth or fungal nail growth, like fungal toenails, that's recurrent or doesn't seem to go away, that might be an indicator of poor blood flow because you need blood flow to the fingernail and the nail beds so you can deliver white blood cells to the area to get rid of these fungal growth that happens. So nail growth is an indicator. And then lastly, blood pressure. See, normal blood pressure is 120/80. If your blood pressure is much below that, say 105 or 100 systolic or below, and then your diastolic, the lower number, is 65, 60 or below, and you also have accompanying symptoms of you feel lightheaded, dizzy easily, especially when you change position from bending over, getting up, you get lightheaded, dizzy, that might indicate that you have low blood pressure that's not good enough to get enough blood into your brain, therefore leading to cognitive fatigue. So those are all very common things that's ignored in both the natural alternative medicine and conventional medicine, where they just say, well, your blood pressure is kind of low, but that's great, so you're not going to die of heart disease. Well, low blood pressure can be just as problematic, as well as having the circulation problem. They usually blame it on something else instead of looking for the root cause. Now, the second root cause of cognitive fatigue could be blood sugar imbalance. As I said earlier, your brain is very energy sensitive and requires proper fuel. And one of those fuel is glucose, which is coming from the food that you eat. Now, your body, your brain, has these mechanisms to regulate blood sugar, so it's tightly regulated in a tight range. So if you get hypoglycemia, which is low blood sugar, then that means the regulation of your glucose level in your body is broken. Okay, there are many different ways your body regulates this, but it's broken due to either your dietary choices, inflammation status, chemical toxicity. Various factors can break this blood sugar mechanism. Also, the other side of this is insulin resistance. This is where you're consistently having high blood sugar and it's causing, again, the hormone that regulate blood sugar to not work anymore. So now you have high blood sugar as a result. Now, both low and high blood sugar are very damaging to the brain. It needs steady supply of glucose, so it's not too high, not too low, just got to be just right. So blood sugar imbalance can definitely create this cognitive fatigue and decrease brain endurance, make you less sharp. Now, another root cause for brain fatigue is fatty acid imbalance. Now, your brain is made of primarily structural fat, around 70% fat. So fat is raw ingredient for the brain to actually make the structure itself. The brain needs the fat to make cell membranes. It also needs the fat to make the myelin sheath, which is the outer covering of the nerve, so you can transmit neurological messages. So it needs fat, and it also needs a balance of the fat. So here we're talking about the omega-3 and omega-6 fatty acid. Now, these are essential fatty acids. Essential meaning your body cannot synthesize these fatty acids on their own, so you must get it from the diet. Dietary sources of omega-3 comes from fatty fish, like fish oil, different types of nuts and seeds, like flax seeds or hemp seeds. So omega-3 tend to have an anti-inflammatory effect. Omega-6 fatty acid, on the other hand, typically are vegetable oil based. That's going to be a corn oil, soybean oil. A lot of your partially hydrogenated fats are also omega-6s. And omega-6 fatty acids tend to have a pro-inflammatory effect, which means that it promotes inflammation. Now, in truth, both omega-3 and omega-6 are both important. They're both essential to the body's function. So it's not that this is pro-inflammatory, so we think it's evil. No, we need both. It's the ratio and the balance between those two that are important. In a healthy individual, the balance between omega-3 and 6 should be about 1 to 1 up to 1 to 4. That means for every 1 omega-3, you should have between 1 to 4 omega-6s. That's pretty balanced. The standard American diet, for every 1 omega-3, the standard American diet intakes about 15 to 20 omega-6s. And you wonder why inflammation is such a scourge in our country, because it's an imbalanced diet. Now, in addition to the balance, also quantity of fat is important. Now here, we're actually talking about the right amount, which means some people, they're eating a very low-fat diet. Maybe they're vegan or vegetarian, or they're purposely eating very, very low fat. And what happens if we don't have enough quantity of fat intake, remember the brain is 70% structural fat, then you're not going to be able to make healthy brain cells or have healthy brain function. And these fats are brain's way of regulating its own immune system and inflammation as well. So it's important to have good fatty nutrient to promote good cognitive function. Now, the next root cause is brain-gut axis. So there's a brain-gut connection that's a bidirectional communication superhighway between the brain and the gut. This is very well established in science. We talk about a lot about this in our YouTube channel. Now, because they function together, the brain and the gut, that means they also falter together. When one area breaks, the other area breaks with it. So this is where leaky gut comes into play. Okay? Now, leaky gut is a chronic inflammatory condition of the small intestinal lining, or it's a state where your small intestinal lining becomes permeable, where the lining typically holds the food and the bacterial poop all inside the intestinal tract, so you poop it out on the other end, but now it's becoming too leaky. So these dietary protein and microbial content can leak out of the gut lining into your bloodstream, and that can cause a double whammy of inflammation. And that inflammation is not just confined to the gut, by the way. It's systemic inflammation that can spill into the brain, cause brain inflammation, leading to cognitive fatigue. But also, you also get malabsorption. And when you get malabsorption, you can't absorb the nutrient very well. So you may have micronutrient deficiency. Then your brain's not going to function without having the proper nutrient. So brain-gut axis dysfunction can cause brain issues. And then next is brain inflammation. Now, in your brain, the hallmark of brain inflammation symptoms are brain fog, fatigue, depression, memory issues, recall problems, and cognitive fatigue. So if you have cognitive fatigue, brain inflammation could be a reason why you're having that. Now, in your brain, normally your brain controls inflammation via these specialized immune cells called the microglial cells. Microglial cells are specialized immune cells that are there for housekeeping. They get rid of damaged and old, injured brain cells to kind of keep things nice and tidy in there. But if you have excessive influences that are triggering the microglial cells to be overactive, then the microglial cells not only clean up the old and injured cells, it's going to start to kill off the healthy ones too. And we don't want that. We want to preserve our brain cells. So when the microglial cells gets activated, you start to lose healthy brain cells at a faster rate than normal, and that can cause a lot of inflammation. When your brain's inflamed, it's very difficult for brain cells to transmit these nerve messages from one brain cell to another, leading to a decreased nerve conduction velocity, which people perceive as brain fog or inability to retrieve information. Just a slowness of function and a decrease in function. So brain inflammation could be a factor. Next root cause is food sensitivity. Some people are sensitive to specific foods. Gluten is the linchpin of them all, especially when it comes to cognitive fatigue. But you can really be sensitive to any number of foods and still create this type of inflammation pattern. So what happens is gluten is known to cause leaky gut, as we just talked about in the brain-gut axis. And when you have leaky gut, you get this double whammy of inflammation. And remember, this inflammation is systemic. It's not just in the gut. It spills into the entire body, cross the blood-brain barrier, and cause brain inflammation, leading to cognitive fatigue. But moreover, we also know that gluten can create what's called cross reactions. This cross reaction means that the structure of gluten, the protein amino acid sequence of gluten, looks very similar to the protein amino acid sequence of certain neurological tissues, such as cerebellum tissue, which is in the back of the brain that controls balance and coordination. In the literature, it's very very clear that gluten reaction can cross-react where your immune system has a mistaken identity. It sees the gluten compound and wants to attack it, but it sees your brain looks very similar to the gluten compound. So every time you eat gluten, if it sees gluten as an enemy, it's going to start to attack brain cell as well. So this can cause autoimmune of the brain. And when you have autoimmune of the brain, then your brain's going to be inflamed, and that's going to cause cognitive fatigue. Another factor to look at. Now, chronic stress is another root cause of cognitive fatigue because when you are stressed, right, stress normally should be a short-term acute thing where, if you're a caveman, saber-toothed tiger is chasing you, that's short-term. It's done and over with. But with chronic stress, basically you're being chased by the saber-toothed tiger day in and day out and doesn't ever stop, which is very abnormal. So then what you have is an overuse or overconsumption of fuel, right? Remember, fuel is so important. But when you're constantly under stress, you're constantly using your body in a way that's unsustainable. And then so basically you use up your fuel, so it's almost like you're running on empty. So that can cause cognitive fatigue as well. And this extends more than just fuel because chronic stress also causes hormonal changes, inflammation changes, all of which is going to lead to brain symptoms. Next is poor sleep. Now, during sleep is when your brain actually heals and recovers, especially during the delta wave, which is a very deep sleep where your brain activity is very slow, right? Because it's resting. So you're going to have slow delta wave, which means that your brain gets a chance to recover. Also, your brain, you have what's called a lymphatic system. These are newly discovered lymphatic structures in the brain that help your brain to drain the cerebral spinal fluid, may play a role in immune function, in healing responses. And this only, both of these delta waves and lymphatic drainage only happens when you're in deep sleep. So getting proper sleep is really important. Some people purposely stay up too late to watch Netflix or play video game, whatnot. That's very harmful. Some people have shift work, and that can disrupt the sleep. Other people have sleep issues because their diet is not right, their lifestyle is not right, they're not exercising correctly. There could be a lot of other factors like inflammation that's driving poor sleep. So this is where we want to identify what's the reason for the poor sleep. The next is environmental toxins. Now, environmental toxins are very, very damaging to the brain. Many of these toxins impact the brain very much so. And the way they do that is by either causing neurotransmitter disruption. Neurotransmitters are neurochemicals such as dopamine, serotonin, GABA. These neurochemicals help you to be able to function and be motivated, feel happy or relaxed. These toxins interfere with neurotransmitter function. So then they don't work the way they should. Also, they can cause biochemical changes. Much of the brain function depends on enzymatic function, right? Enzymatic reactions so that your brain cell can produce certain chemicals and substrates so then brain cell can function. These toxins can disrupt these biochemical reactions and disrupt enzymatic function so your brain can't make the chemicals it needs to sustain its own function. Also, environmental toxins can cause oxidative stress. Oxidative stress means your brain cells is being damaged by oxidizing. And that damaging of the brain cell can cause brain inflammation just from the structural damage. Furthermore, you can also have mitochondria dysfunction. Your brain cells produce energy via the mitochondria in the brain cells that produces cellular ATP, which is the energy source. And toxin can damage the mitochondria, leading to low energy production, therefore causing cognitive fatigue. And finally, chronic infections. Okay, we're not talking about acute infection. You get food poisoning or you get a cold or a flu and you get over it. We're talking about chronic infections. A lot of people have chronic infections like Epstein-Barr virus or cytomegalovirus. These chronic infections can cause this depletion of your immune system and chronic inflammation. Many of these viruses can actually infect the brain itself, cause chronic brain inflammation, and even leading to neurodegeneration. You can certainly have infection outside the brain that can also impact the brain function. For example, you can have gut dysbiosis. If you have bacteria, small intestinal bacterial overgrowth, candida overgrowth in the gut, due to the brain-gut axis, if you damage the gut, you're going to damage the brain. That's how infections outside of the brain can also cause brain symptoms. Sometimes you can have systemic issues like systemic candidiasis, or you can have bacteria in other places outside of the gut or outside the brain that can also cause issue. Many times people with chronic infection have an immune system problem where the immune system is weak. It can't finish the fight. So we need to identify what's the reason for the immune system imbalance and bring that back into balance. As you can see, there may be multiple causes that can lead to cognitive fatigue. And you may have unique and different causes of cognitive fatigue compared to someone else. So it's vitally important to work with a functional neurologist and functional medicine practitioner using the neurometabolic roadmap to help you speed the healing process. Now, here are 7 practical strategies to consider implementing on your own to start the process of reversing your cognitive fatigue and improve your brain endurance. Now, before I share the strategies with you, I want to give you a clinical nugget that will help you get double the benefit from the recommendations. And that is, the strategies are also the test. Now, what do I mean by that? That means if you implement a strategy that fixes a specific pathway and you notice an improvement, then that proves that that pathway was broken and needed fixing. On the other hand, if a strategy you implement doesn't result in much improvement, then it means that that pathway may not be the main symptom generator for you. Now, keep in mind that there may be a synergistic effect of implementing multiple strategies, and they may generate improvement when you do them all. Now, this is for you to find out. So you got to try it and then find out what works for you. So with that said, here are the 7 practical strategies to consider to beat cognitive fatigue. Now, the first strategy to improve cognitive function is to improve brain circulation. We got to get blood into your brain at a greater rate than before. And we can do that with exercise. Exercise is about the greatest thing that you can do for your health. And there's 2 different types of exercise. One is the high intensity interval training. And when you're doing high intensity, the goal is to get your heart rate up as high as you can for short bursts. And that high heart rate and high intense activity gets that burst of blood flow to gush into your brain. And that's really actually good for the brain. Research showed that high intensity interval training actually increases what's called brain-derived neurotrophic factor, BDNF, which is a chemical that your brain produces to help brain cells to stay healthy and to be able to produce neuroplasticity so your brain can actually make new pathway. And high intensity interval training has been shown to do that. Another way to exercise is to do what's called the aerobic exercise. Now, when we say aerobic, we mean exercise in a certain heart rate where you're burning oxygen for energy exclusively. So if you're doing high intensity interval training, that's not aerobic, that's high intensity. Aerobic will be your slow and go, steady state exercise. Typically we do this by measuring your heart rate. We want your heart rate to stay at a lower zone. Typically we do what's called the maximum aerobic function by Dr. Phil Maffetone, which is 180 minus your age. That will be your maximum training heart rate. If you have any type of, if you're on heart medication, then you might want to lower it. If you're very out of shape, you might want to lower it by about 10 beats and start there. But at that particular heart rate zone, if you stay exercising in that, it's going to be very easy for you and you can sustain it. Aerobic exercise also has been shown to increase the area in the brain called the hippocampus, which is the area in the brain that actually forms long-term memory. It's also the area in the brain that gets damaged in people with Alzheimer's. So it's very important to incorporate both types of exercise to improve circulation. Now, on a supplement front, there are actually specific supplements that have been shown to have a brain circulation enhancing effect. So some of these supplements include ginkgo biloba, which is a very famous supplement. They call it, the supplement that helps with memory. How does ginkgo help with memory? Well, specifically, it helps to improve blood flow to the brain. And when you get blood flow to the brain, then you can get more fuel to the brain, therefore improve brain function. So really, it's not because ginkgo is increasing, brain cells or making more dopamine. It's because ginkgo is improving blood flow. Another compound, nutritional compound, is called vinpocetine. Vinpocetine is a compound that has been shown to improve cerebral blood flow. And actually, there's some studies where they use vinpocetine for people with stroke to see if they can improve blood flow, and they show that has some beneficial effects. So ginkgo, vinpocetine, even cayenne pepper. Cayenne pepper, if you ever had cayenne pepper, you'll feel the heat and you start sweating because it's getting blood flow to your brain. That can be helpful. And some people use beet root or beet juice. Beets can improve blood flow, but it's not necessarily specific to the brain, but it can improve blood flow everywhere. So beet could be another choice as well. Now the next step then, strategy to improve cognitive function is to stabilize blood sugar. And in stabilizing blood sugar, don't make it more complicated than it has to. In general, what you want to do when you're improving blood sugar from a dietary perspective, you want to lead with protein, right? Have a good amount of protein, add tons of veggies on top of the protein, and then you want to have moderate amount of fat because your brain needs fat, and then you want to reduce carbohydrate intake. It doesn't mean you have to eat a low carb or no carb diet. It just means that most people are eating way too much carb, or the source of that carb, the quality of that carb. You want to eat as much natural food as possible, whole food that's not refined or processed. If you can reduce the sugar intake and refine carbohydrate intake, lead with the protein, lead with fiber, you are going to do much better than most people. Now, if you have hypoglycemic tendencies, low blood sugar tendencies, you might want to consider eating more frequently to stabilize that blood sugar. If you have a high blood sugar, then you might want to consider eating less frequently, maybe even intermittent fast, so that your insulin has a chance to reset. So that's frequency of eating, but again, dietary choices is what matters here. Next is picky. Get picky about fats. Get picky about the fats that you consume, okay? So what that means is you want to make sure that you're reading the labels of anything that you're eating that's in a package. And usually if it's a organic or gluten-free chips or whatnot, you'll see the ingredient always have some kind of canola oil, sunflower oil, safflower oil. Those are all things that's not as good as you think. You want to avoid those industrialized, processed seed oils. Rather, go with your organic, extra virgin olive oil. You can use your organic coconut oil, avocado oil, eat natural nuts and seeds. Eat fish, fatty fish, like your salmon, mackerel, anchovies, sardines. You want to think about grass-fed beef. You want to think about nuts and seeds like walnuts, hemp seeds. These are all great sources of omega-3s and healthy fat. If you consume natural sources of fat and avoid the processed fat and the fried foods, you're already going to be doing much better than the average person. Next, we want to stimulate. So what do we want to stimulate? We want to stimulate the vagus nerve. Now, the vagus nerve is one of the cranial nerves that exit the brainstem. And the vagus nerve actually innervates the entire gut. So by stimulating the vagus nerve, you're serving three purposes. Number one, you're going to stimulate gut function. You're going to stimulate gut secretion and gut motility. All of that's going to improve the likelihood of you not getting leaky gut or healing from leaky gut faster. So that's going to help with the gut. Number two reason you want to stimulate the vagus nerve is that when you stimulate the vagus nerve, you're going to stimulate that parasympathetic nervous system function, which opposes the stress response, which is going to be your sympathetic fight or flight response. So you're going to reduce stress, which is another cause of cognitive fatigue. And then the third reason why you want to stimulate the vagus nerve is that the vagus nerve actually directly dampens inflammation through what's called the inflammatory reflex. So what that means is proper vagus nerve function actually play a major role in dampening the body's inflammation. When you can dampen inflammation, you're going to reduce brain inflammation, you're going to reduce systemic inflammation, and that's going to be very helpful. So how can we stimulate the vagus nerve? Well, there are specific exercises that are specifically stimulating the function of that nerve, right? In functional neurology, if you want to improve the function of a nerve, you'll simply use that particular nerve, whatever that nerve controls. So the vagus nerve controls some of your throat muscles, your swallowing muscles. So you can do gag reflex while you're brushing your teeth. You can just push down on the back of the tongue to induce a gag reflex that's mediated by the vagus nerve. You can also do what's called the gargling. So while you're brushing your teeth, you can just drink the water to rinse out the toothpaste. You can gargle that very vigorously, and that's also the throat activity. It's going to stimulate the vagus nerve. And finally, you can also do humming. This will be humming very deeply, coming from the throat. And this humming exercise can create a vibration, which is a sensory type of stimulation, as well as the motor component of the humming, which also stimulates the vagus nerve. Finally, you can also do deep breathing. When you slow down your breathing, especially accentuate and elongate the exhale, you increase heart rate variability, which is a measurement of parasympathetic function, which puts you in a relaxed state. So we have vagus nerve exercises and breathing exercise that you can do to stimulate the vagus nerve. We can also electrically stimulate the vagus nerve using electrical stimulation. That will be the topic of another video. Next, we want to optimize sleep, because sleep is so vitally important for brain function and cognitive function. So when talking about optimizing sleep, all of the above tips here all contribute to proper sleep, especially the blood sugar, especially stimulating the vagus nerve, because a lot of people go to sleep stressed, right? So you want to be able to calm down at the end of the night. Stabilizing the blood sugar will have a very powerful effect in helping people who have trouble staying asleep. But really, when it comes to optimized sleep, it's about routine. You want to have a good routine. And the routine is not just at night. The routine actually starts when you wake up. Okay? When you wake up in the morning, you want to be exposed to light. You want to be active and going about your day early. You want to stabilize your blood sugar and not just eat a donut or a bagel first thing in the morning to spike your blood sugar. Start the day and have a routine for the day. And you also have a routine for the night. When you're ready to go to bed, you want to turn down the light. Don't get on the electronics with the blue light exposure. And there are obviously some people that may have other problems like sleep apnea, or they have some type of inflammatory condition or pain that may be interfering with the sleep. So we need to address that. But really, the routine is the all-important thing when it comes to sleep. Next, we want to reduce inflammation, or specifically brain inflammation. So how can we reduce brain inflammation? Well, some of the things that we talked about by stabilizing blood sugar, improving circulation to the brain, improving fat intake, stimulating the vagus nerve, all have an effect on reducing brain inflammation. Now, obviously, we talk about the brain-gut axis. Healing leaky gut can have a powerful effect in reducing brain inflammation as well. Specifically, with nutritional supplement, we want to choose compounds that can cross the blood-brain barrier where it matters and can actually be of help. Those will be turmeric, resveratrol, fish oil, glutathione, apigenin. These are compounds that can cross the blood-brain barrier and have an anti-inflammatory effect. Where other compounds that are maybe anti-inflammatory, if they cannot cross the blood-brain barrier, it's not going to do as much good for you. So we want to focus on those things. Lastly, we want to activate the brain. Just like if you have a weak muscle or injured muscle, you would do rehab or exercise to strengthen it. If you have an area in your brain that's not working as good, then you want to strengthen that. The way you strengthen the brain is by doing exactly the thing that's usually you use for that particular function, right? If you want to strengthen your bicep that's weak or been injured, how would you strengthen it? Well, you activate the bicep by lifting weight with it. If you have cognitive fatigue, where you feel like you have trouble, remembering things, then you want to do memory games, right? Now, people say, well, I can't remember, that's why I'm having the problem. Well, what you would do, you would start slow and work your way up. Just like if you just injured your bicep, you wouldn't start with the maximum weight, you would start with a very light weight, and as you get stronger, you do more and more and more. So the concept in neuro rehab is that whatever is difficult for you, that's exactly the thing that you want to do to make it better, to make that brain function better. So if it's math or organizing yourself or concentrating, well, those are the activities specifically that you want to do. You can start small and work your way up. By activating the brain cells, by doing those activities and feeding the brain properly with proper rest, proper exercise, and proper fuel, you're going to be able to improve your cognitive function. So there you have it. These are strategies that are free or low-cost ways to start improving your brain endurance and overall health. Now, you can start with just a couple of strategies and see how they work for you and gradually incorporate more as your brain endurance improves. The key is consistency and being patient with yourself. Improving brain endurance is a lot like improving physical endurance. It takes time to notice you getting stronger. So give yourself a chance to let these strategies work. Now, you may have a unique condition or a unique situation that may need more individualized testing and strategy. This is where working with a functional medicine doctor and a functional neurologist who can connect the dots between nutrition and brain function can really help you identify the root cause and create a customized plan. If you're interested in consulting with me to help you feel your best, check out the link in the description. Now, I hope you learned something new that gives you more clarity to master your health. Please like this video and let me know what you liked about it in the comments. Now, to get more great videos like this, please subscribe to my channel and hit the notification bell so you get notified when I release new videos. God bless you and see you in the next video.